important for all of us as Nigerians, because I mean, at the end of the day, whatever happens at the top, it trickles down and it affects us all. Yes, it is still Mainland 98.3 FM, Mainland Focus. The focus for this morning is as regards the health sector and the oil and gas sector. My name still remains Omobola Sandra. Fuhad Saeed is joining me in the studio now. Hello.
I'm here. Good to be here.
All right, so we were talking about people paying attention to their health and whatnot, and on Friday, Lilian was giving out tips on, especially asthma patients. This season is not a wonderful season for asthma patients because of the harmattan, the dryness,
dust and all that. Yeah.
So it's something that a lot of people have to pay attention to. Carry your inhaler everywhere, wear your face mask if possible at all times. And now here we are in a situation where some people are calling for a medical state of emergency. So at this time now, we need to start asking the right questions. If we have one doctor that's available for 8,000 Nigerians, that ratio is scary. And that's why we need to we need to actually have that conversation. Has it actually gotten to a point where we need to actually declare a state of emergency on the health sector?
Definitely, I think we are getting to a point. Even before now, we should have declared the state of emergency on the health sector. I always say that if you want to know the state of our health sector, just go to the public hospitals and see what's going on there. The crowd, the lack of facilities, even basic tests, you have to go out into private facilities to get them done. So you have a situation where it's even dirty, the emergency area is always crowded. I've seen situations where people are brought in and they are laid on bare floor for hours.
I have
even go to some maternity hospitals, public maternity, except for Lagos, that has done quite well when it comes to maternal child care. Go to some other states, go to their maternity hospitals, and you see babies, being put on the floor. Sometimes the mothers are on the floor. There's no incubator if there's a situation of a preterm birth, and so we are on the brink of a total collapse as far as the health sector is concerned. And like I said earlier in the morning, Sandra, if the facilities are not available, but at least we have professionals that can manage through, work through the lack of facilities. But we don't have the professionals we are living to. So the facilities are not available, the personnel are not available. So you can see that we are in what you can call a double jeopardy. And that's the reason why it is time to really focus on the health sector and declare a state of emergency. Yes, we have a situation where, people are just going to be dying in droves. Half of the things that kill Nigerians are things that can be resolved medically. But where is the facility to take care of those things?
I mean, at this time now, we have the fact that every day there is at least 5 doctors, or there are at least 5 doctors leaving the shores of the country. It's a very unfortunate and ugly thing. We've been talking about the brain drain and how, in the IT sector, it's very scary. A lot of people are losing money at this time. There's easy access for cyber attacks on people's accounts as it is now. And here we are now, even in the health sector, where there should be some sort of focus. One of the things that I took away, or one of the things that I remember distinctly from yesterday's town hall series, is when the presidential candidate of the Labour Party said that subsidies should be focused on the health sector. And we had that conversation some months ago as regards the NHIS and how available is it and affordable for people. A lot of people pay over the counter, at the hospitals. It's very when you get to the hospital and you see some people bringing out their insurance cards and say, well, I have health insurance, but then
how many people are covered?
And here we are now, they're projecting we have 1 doctor to 8,000 patients. Everybody in the health sector is saying something. The National Medical Association is saying something. The Medical and Dental Consultants Association of Nigeria is saying something. The Nigeria Association of Resident Doctors is saying something. And if you have highly skilled doctors leaving the country, who's going to train the upcoming ones? So aside from the fact that we are losing highly skilled doctors, the future is also at stake when you don't have sufficient or properly trained doctors in the country who are willing to do whatnot. There was a time that we had the auxiliary nurse problem, where you go to some private hospitals and it is nurses in training that are attending to people. That's the thing. So hope we will not get to that.
I know Sandra from the town hall meeting, I said this morning that it was funny that some of the candidates could not even commit to using our health facilities. For Atiku, for example, when he was asked whether he was going to declare his health status public and use our facilities here in Nigeria, he said, look, the Nigerian facilities that cater for my health will not be available.
What's peculiar about his health?
I don't know. You know that we have limitations. So it means we have limitations. We have been talking about those limitations. And on his plan for ensuring that healthcare is readily available for an affordable, he said, I will review the Nigerian health insurance scheme system initiated when I was vice president, make it inclusive and affordable for all Nigerians. How? He didn't say. I think one council just made a comedy out of it that, look, doctors have told him that he's going to live more like 30 years more. That's what he just said. It was just about laughter.
So you just paid attention to himself.
Yeah, that's what he said. You know, I think it was really Peter Obi that said that, well, he would make his health status public and he doesn't have any problem using Nigeria health facilities. But again, it just goes to show you that, look, we need to really grow these guys and probably make it a national policy to say, look, as a public official, use our health facilities. Many people will make attention and then take it seriously.
You know, some months ago, there was the news, and a lot of people were saying, why is this news? Why are people talking about it? But it is news when you hear that the vice president had his surgical operation done here in the country.
And
then we were saying, imagine celebrating the fact that
I think it was a fracture or something on the knee, or
it was a fracture on his knee
or something.
But imagine people were so happy with the fact that he did. It's supposed to be a normal thing, and we're celebrating it. And then some people were like, oh no, they still have to fly.
No, I think I told you that, look, my own we don't have it here. Has
it gotten to a point where we need to declare a state of emergency in our health sector? How do we commit governments at all levels, federal, state, local, to pay attention to the health sector? You go to some medical health center, not hospitals now. Health centers.
The local communities.
The local communities. And Fuad, I must confess to you that you go there with something, you come back with
at least
50 medical elements.
See how untidy the place is and all that, So we are even doctors in the health centers really to attend to local communities and local needs of the people.
I've been when I was staying at Ijebudia, and I can tell you that there was a time that I had some distress and I had to quickly go in, and there was no doctor inside to attend to me. It was very, very unfortunate. If not that there was a very experienced nurse who was on duty and just quickly did what she had to do. I mean, God knows what may or may not have happened.
That's the condition of most Nigerians.
And that is the condition. A lot of what if the people that were on duty that they were people that were still coming up,
training nurses
on ground, and then there's nothing anybody can do. All right, but then can we compel our politicians at this time to now start using only Nigerian health facilities? Will that help? If they know that the only option they have is here, would they pay attention to the health sector? All right, and it's something that we need to talk about. So 3 questions as regards the health sector. Has it gotten to a point where we need to declare a state of emergency on our health sector? How do we commit the government at all levels to pay attention to the health sector? Let's not remove the local government. Very important, because the medical centers down there
should be under
their purview. All right, so can we compel our politicians? Do we have to get to that point where we tell our politicians, your children have to study here, you have to do your medical checkups here? All right, because even the expenses, the operational cost of traveling,
they don't mind.
The fleet that they have to pay for all of those things just to go and see a doctor abroad. Can we have that conversation? The second one, of course, is a warning issue that we need to keep talking about. Is why is importation of fuel subsidies solely on NNPCL? Why can't it be decentralized? Let other people have the opportunity. Aside from that, why is the federal government and the NNPCL silent as regards the fuel scarcity on ground. So two questions or two issues on the table this morning: the health sector and the oil sector. We need to focus on this one because at the end of the day, if there's no light in the hospital, I've heard of them using candle to do operation.
And the quality hours the Nigerians lose, queue
at the filling stations.
And all of that,
09136000410 09136000410. That's the number for you to call, or you can send a text message or a WhatsApp message, and let's have this conversation. Two things on the table this morning: the health sector, has it gotten to a point where we need to declare attend to their health problems here?
This Timothy coming in from Nigeria. Everything we are discussing boils down to leadership. If we have good leader on ground, this will become things of the past. Are you with me? Okay, see the front runner now, the way they answered. I think it's not even sure that we can use our facility here. See, if we have leaders who are determined to make this work, you see, ordinary Nigerian one day, this thing we are talking about. Are you with me? Okay, why is it that NFPC is the sole importer of fuel if we cannot refine here? It's one corruption that they have been enjoying. And now the independent marketers, they have fuel, the NFPC has not. You see, they know what they are doing. If the leadership is okay, good leadership will have it, every other thing will follow suit. That is what we have been lacking. If you want to trade this to the fundamental thing here is leadership. We have not been getting right from the grassroots of leadership. Right now, I believe that by God's grace we will get it right now. If you are able to get it right, you see every other thing will follow suit. It's simple as ABCD.
Thank you, Mr. Timothy.
What I'm afraid of before I round up, please, if INEC will not compromise this time around, now they are talking about telecommunication to give them guarantee. Those areas you are saying the glass will be able to ahead. You see, I pray will not be a sort of compromise, because at the end of the day they will say the report we got, it cannot make us to transmit results on the phone.
They're working on it, so let's put some faith there. Let's put some faith out, all right? Well,
optimistic.
All right, thank you very much, Mr. Timothy. 09136000410. That's the number for you to call and share your conversation. Share in the conversation. Hello.
Good morning. Good morning.
You guys.
Fine.
I've been out of the States for some time. I hope you guys are fine.
We are fine.
Welcome.
I went for a bit, my sister, I went for a bit where people being up on Obasanjo, where you see how they were enjoying themselves, and we supporters are busy quarreling. It's really unfortunate. You see, let me shock you now, I did, Obasanjo awarded 774 health centers with residences for the doctors. I did 13 of those things in Kebbi State. Do you know we completed and handed over? I went to my local government owner, they are still in the health centers. 774 local governments. Very massive, very easy. We for comfortable stages and manage our things, we will not have problem forward. I went to check because I didn't do him and I did in the north. I went to see the guy that they have stolen everything from that. The hotel equipment, everything they have stolen everything. The governors are not interested, they don't want to put in use. The local government are not interested. What they were busy fighting local, because this phone was gotten from Algon, that is the association of local government teachers. Yes. So governors were busy, angry that the country has been controlled them. They have been handed over this thing, they are not monitored, and people are
just abandoned it.
Abandoned it after completion, and we have handed over. People are talking of healthcare. It's really unfortunate. If you talk about, at least my health has come back since I went to the hospital. As I was sleeping, I didn't call on phone, and my sickness has started again. I'm back to Lagos.
You'll be fine.
Thank you, Sandra.
Thank you very much, Mr. Alvin. All right, hello, good morning.
Good morning, Sandra and Mark.
Good morning.
Good morning, Master.
Yeah. On these two issues we are discussing, I think to me it is a double-edged sword, because I believe that the starting point to enable us do justice to this discussion is to first of all determine whether the president and the vice president and other ministers of the federal government, whether they have appointment letter, so that we know what the benefits are. Because you can just, somebody cannot be a president or a vice president or a minister with open-ended letter of employment. Because since Buhari entered, how billions, if not trillions, he has spent on medical tourism abroad. Is it Nigerian money or his money? And if it's Nigerian money, does his employment letter or position of service look in line with the amount? Yes. It is what Nigerians want to know. But even in dictatorship, even when he was a military dictator, I'm sure there is a limit to whatever benefits he was enjoying. And the issue of putting a limit to it, if we want to put a limit to it, first of all, we have to know what his condition of service is now. And then it is the Senate at the National Assembly that is supposed to promulgate a law to limit whatever they are encouraging. At least Barrister Oshibajo has successfully in Nigeria. So if Oshibajo has surgery in Nigeria successfully, why should Buhari be spending billions? Even the money to use for his plane to pack, he bought at the budget of a state.
Alright, thank you.
Yes, so the press, people are crying, but I think the press is not crying enough.
Hello, good morning.
Good morning,
Mr. Damola.
Good morning,
sir.
Honestly, talking of healthcare Nigeria, it's as if we are talking about buried matters and forgotten issue. Because these people will not stop traveling to foreign countries. They will follow here. There's nothing, absolutely, until we stop them from going to foreign countries for medical treatment. Nothing won't work here. And the funny thing is, the brain drain we are having in the health sector will soon propagate to the education sector. Because this government is not just ready. If you go to local government, clinic there are advanced mortuaries. Nothing is working. Ordinary paracetamol, if you get it honestly, it will be a kind of damage. I'm telling you. Now on the second matter, the government cannot unbundle that aspect. Sandra, if they unbundle it, many things will come out. A lot of sick, in fact, what will come out, many of us will not be able to bear it. That's why they monopolized it and limited it to their sector. In fact, to that sector alone. Thank you, good morning.
Thank you very much, Mr. Damola. 09136300410. That's the number for you to call. You're listening to Mainland 98.3 FM. Hello, good morning.
Hello, good morning. Mainland FM.
Good morning.
Good morning.
You see,
your name and where you're calling from, please.
Okay, this is Mazi Emmanuel from Ajo.
Okay.
Alright, thank you.
Yes, one thing I would like to liken Nigeria to the situation of a madman who put a little fire during the Harmattan to warm himself. And when the fire escalated and burned the market, he said he didn't put the fire there, he put the fire here. You see, Nigeria has caused a lot of problems for themselves. I'm talking about the flooding.
Okay.
When you allow one person to import rice, to import potato, to import fufu, to import everything, to allow them to do it. Nobody talks. The National Assembly did not talk. The state did not talk. Now, government is doing what they like. So nobody is talking them. They can do what they want to do. Who all know this? For example, the governor of the South, are all coming to Abuja to look for money every month. But Lagos is taking more money from Freeport, and they cannot talk of their Freeport. My brother, I'm sorry I'm just a little bit. I just want to tell you that Nigeria is like that madman. They put the fire here. I want to fire people calling the headquarters because it's not the one that is fire. That is Nigeria. Think well and listen to what I'm saying. Thank you, my sister and my brother.
I think you are another bit of a madman.
All right. I was a little bit concerned about that. Hello, good morning.
Morning.
Good morning.
Morning, Sandra.
Good morning.
Good morning.
Good morning, sir.
We are with you. Carry on.
Are you? My name is Akinade from Mushi.
Oh, okay. Morning, sir.
Yes, sir. I want to talk about three things.
Okay.
First of all, I want to talk about the money signed by the local government chairman. Why is it that out of that money, they give the chairman 3 million?
Mr. Akinade,
Yes.
can we stay on focus? We have two focal points for this morning. We have the health sector and the oil sector. We have serious, challenges in those sectors. That's why we're focusing on this morning. So, do you think at this point now we need to declare a state of emergency in the health sector, looking at the fact that we have 1 doctor to 8,000 Nigerians?
Okay. About that doctor you are talking about, I think the government should be able to do something so that those who that have left already, they have to make sure that they replace them. You understand what I'm saying? You understand?
We are with you.
So, in order to be able to cover this area, fuel, the shortage of fuel in our country. As a side aspect, let them open way for the other private group, bringing the oil into this country, so that when they give license to them, I believe that we are going to have enough. So that's the reason why the government has to stick to that, so that we will not continue in this shortage of fuel.
Thank you. Thank you very much, Mr. Akinade. I appreciate. Hello, good morning. Speaking of Mr. Akinade from Mushi, I think we need to check on, Ambassador Musbao also. It's been such a long while. Please, if you know how we can reach him, we would appreciate. Just send a message. I would like to check on him and ensure that he's doing fine. That's Ambassador Musbao, one of our other listeners, calls in from Mushi. Thank you very much. Okay, 09136000410, Mainland Focus, health sector and oil sector. Hello, good morning.
Good morning.
Good morning.
This is Patrick Kokoro from Ikorodu.
All right.
Ambassador Musba is doing well. I'm hearing from other station. It's okay.
All right.
Don't worry about it. Come to our discussion about health. Don't be carried away about the surgeon, our vice president. Hello?
Well, with you.
Yeah, don't be carried away. He done a little surgery and he put it in the newspaper. I myself, I'm talking to you. I am Patrick Kokoro from Ikorodu. My leg is going to be cut out. You understand? In 1998. But the doctor treated me. And my leg is okay. I'm playing football. I'm jumping up and down. This is where I put in the newspaper. I do publicity anywhere. You understand? So we should be carried away with all this much more information. So come to Peter Obi that say that you not travel abroad. Buhari say more than this.
He doesn't mind.
Buhari say more than this. But we are seeing the result. You understand? Hello?
Well, with you, Mr. Patrick.
Yeah. So Peter Obi, his thoughts no only water. So this Buhari what we do to the health issue, we should do it. We should do the justice. Thank you.
Thank you very much. Okay, 0913600.
I said I don't mind. Then somebody that said I'm not sure. I don't mind.
Hello, good morning.
Good morning.
Good morning.
Yeah, good morning, I like this about.
I like you.
Yes. Sunday, I told you, ask you a question. Yeah, you asked a question that we compare the politician to attend a medical facility. You see, the issue what power do we have in comparing these people? These people, they are mortgages, they are pagers. We don't have any singular power, to do otherwise with them. It's only God that can save us from them. Let me tell you something. A country that cherishes their citizens, you talk of medical drain, medical professional drain, our medical, their professionals that go to abroad. Those are countries that value their citizens. Look, the mandate job in overseas is nurses and doctors. Why is it that? Because those countries cherish their citizens. They value their citizens. The reverse is the case here. So that is the purpose. Is it a lot of medical facilities is nowhere to be found. Go to Lutz, go to so many hospitals. Because our leaders they don't attend it, they go to ordinary pain in the leg, they go to overseas. So that is the problem. Well, let me go back to NNPC. NNPC is a business center. By the virtue of the constitution that enacts constitution, Nigerian National Petroleum Corporation, they are saddled with the responsibility of being in charge of our oil. But let me tell you today, NNPC is a business center for all the chieftaincy that is there. NNPC does not have people. Look, if you go, they are selling their product in some of these self-owners people, and they are making business with it. So if you as a power of half the people, because they will tell you the one case is coming, they will put further. Your value will they will pay you, they're storage for storage amount. Among that one, among the product, within the volume of the product, there are going to be shortages there. The volume is not there. So it's a kind of business that is going on there. Somebody who is carrying the responsibility of taking care of our wife does not have a depot. So what do you expect from them? The depot they have is not functioning.
It's okay. Thank you very much. Yes. Hello, good morning.
Good morning.
Yes, good morning.
Yes, morning.
Sorry?
Daily,
okay.
Okay, where you going?
From
Agbara, okay.
So the oil sector, this oil sector will work, except all this oil well is contract to federal government. Because individual own oil well, if you not come out for individual hand, there will be where oil well will be to people. We all the talk this is small. You will buy fuel, a liter of the 1,500 for this. If you see the level with all those people want. So if all those things will solve by talking, that all year where we come up for all those people hand, if the individual not will get all year where again, the guy that you know will say.
Okay. Okay.
Alright, thank you. Hello, good morning.
Auntie Sandra and Fuad, good morning.
Good morning.
Good morning, sir.
Yeah, I want to talk about what I am calling from Sango.
Alright, sir.
Yeah, the issue of health. I want everybody to know that the state of emergency does not arrive, because I've been saying that the world is a global village and there is the ability of living across nations globally now. And that is why you see people going abroad to come. Not like they have good condition of service there, but by the time they convert their earnings to naira, they have a lot of money. You have a job as a doctor, a lecturer abroad, and have a driver, a police or whatever to yourself. So it is not better if the government opens employment portal for 50 people now. It gives the more way to going to replace all these accident banks.
Sorry, Chief. Sorry, Chief. When last did you visit any of our public hospitals? When last?
No, I see when my ophthalmology is at the general hospital here is Lions and where tickets. buy tickets, go to it for general hospital. After I visit there, they are going to the hospitals. It's only people are just propagating something in some places. I get there. For my house here.
So when you say the
last time I visited it for general hospital, there was no light. There was no public.
Hold on, sir. Hold on. When you say it's very good, do you mean the quality of service or the facilities?
No. What I'm saying is that the way people are saying that the health sector is dead is not. Come to us at general, go to it for general hospital and see. People are, if I was even surprised when I got to it for very clean.
Before.
That was why I did my COVID vaccination. Okay. I was really very surprised.
Alright, thank you.
So, and the issue of fuel and NFPC is a private company now. Like you have in other countries like Shell, like Mobil and the rest of them. And they are self-accounting, they are no longer under government. As I said, we need more than 100 NFPC and company to open up. All the money you need to pay before you can become an oil dealer in Nigeria to be removed. And I'm telling you, I can get 10 companies that can take care, Saturday or 4 in Nigeria. But because that it is the sector as a monopoly in Nigeria, that is why the problem will continue. We cannot continue because NFPC, the country has nothing all better across the country. They feed all this better across the country. They feed the refinery. So even when the fire arises, you have to send trailer from Kaduna, Santa from Sokoto, from Abuja, from everywhere, and come and look for us. We cannot continue like that.
Alright, so
the sector must be open for all of us.
Thank you.
So that if Nigeria want to bring fuel, let's all of that. And they will bring fuel and sell to people.
Thank you. Alright.
Sandra, what is this?
Good morning.
My name is Ambrose. We thank God for another day.
Yes, so, Pastor Ambrose.
My mother-in-law, the one senior to my wife's mom, lives in Ifo. When she was sick, they took her to Abeokuta. She died at the age of 78. And they are telling us that Ifo has facilities. You see, all of this propaganda, cheap propaganda, why? And when we talk, they say we are insulting them. As if we don't have eyes, we cannot see, or you just said something that the facility to me for.
Because the last time I visited it for general hospital, there was all this in the hospital.
If you like somebody, must you now come and be telling lies? And when we talk, you say that we are insulting you. Nigerians know more than all of this now. If you go to more general hospitals now, it's a glorified mortuary. There are no doctors, there are no nurses. Some of them have closed up. These things are very glaring to the blind and very audible to the deaf. There is nothing that is working. The general hospitals are not working. That's the simple truth. And then these people, the hospitals are working and they will go abroad. They will go for treatment. Hospitals are working and when they have everything, they will fly abroad. We have, if you go all over Nigeria today, I'm telling you, in where I stay here, we have the health center here. The health center itself, the only time you go and you see things is maybe, no doctor, all of these things. I keep on asking, why is it that whatever is happening in UK, Europe, Canada, USA, we cannot replicate it here? Why? Is it that we are different? Do we have a different blood? Are we not all human beings? You just carry money that you don't need. As an accountant general carry 90 billion, you swallow it. Money that is supposed to be used to develop. And you tell me that there will be development. Why are we deceiving ourselves? Why are we like this?
Alright.
Good morning.
Good morning. Thank you very much, Pastor Ambrose. Yes, it is still Mainland 98.3 FM. The conversation this morning on Mainland Focus is as regards the health sector. Is has it gotten to a point where we need to declare a state of emergency? You may not understand or relate to a lot of these stories, probably because you have a very good immune system, or you have
a personal physician,
or you have a personal physician, or you are you pay attention to your health. There are a lot of people who need medical attention one way or the other almost every week. All right, and then they know what they see. I mean, one of our colleagues here was at the hospital some months ago, and he said he got there 7:30. He wasn't attended to till about 3. Okay, and then if you have situations like that, you also have some people say that to see a doctor, there's a particular doctor at orthopedic.
Sometimes with the date you have to fix.
He's booked till February. We wanted to see him as regards the knee, as regards someone on his knee, and he was sorry, he's booked till February. So that means
you have to wait till March.
And if you want to see him aside from the booking, you have to pay extra. How many people can afford that or go to a private hospital? So that is this reality of the health sector as it is now. And we're asking, has it gotten to a point where we need to actually declare a state of emergency on the health sector? Has it gotten to a point where we need to start tasking these politicians, what would they do, or are they willing to make use of our health sector, constitutionally speaking, legally speaking now, enforcing that you have to use the health sector in Nigeria or nothing, so that they can pay attention to it? Or, what can each level of government do as regards the health sector? We are losing doctors, not to death, but, it's a good challenge, but they are going to greener pastures, they are moving on to greater things, but we're losing doctors every day, and here we are, one doctor to 8,000 people. That's the reality of ground. We're also looking at the oil sector. A lot of people, the fuel scarcity still continues, and we're asking this question: why is NNPCL the sole importer of PMS in Nigeria? Why? Someone should explain to me why.
What's the logic?
What's the logic behind that? What exactly is the way? Well, maybe the government wanted to control it. Okay,
control what?
What exactly are they controlling?
What they are controlling is leading us to crisis and suffering.
Here we are. So that's the conversation for this morning. Those are the focal points for this morning on Mainland Focus. The number to call is 091-3600-410, or you can send a text message or a WhatsApp message. And speaking of messages, let's take a few before we move back to calls. This is Samson from Ianopaja. Great job you're doing. All sectors and even we the humans in Nigeria needs to be declared total state of emergency upon. It's okay. Abraham Ayotunde from Ikeja in Lagos is saying healthcare and education should be the top priority of a responsible government. Anyway, Lagos State Health Centers should work on their relationship with patients. Good morning. I think that's another thing to
do. They're frustrated. Doctors to 8,000 persons. So it means maybe 2 nurses to 8,000 persons too. I don't know react. They are human beings too.
That's another thing to look into. All right, we're talking about the state of the mental state of lecturers.
Lecturers too. You see them they are not paying their salaries.
Awolo Christopher from Shobile. Good morning, Sandra and Fuad. Thank you once more for this opportunity. On health first, everybody should as much as possible take care of his or her health. Secondly, let us pressurize our leaders to compulsorily patronize our hospitals and health facilities. But most importantly, either health sector, oil sector, education, etc., the main solution centers on genuine restructuring of the polity. Starting point being making sure that APC and PDP do not return to power at the center. But that's his own personal opinion. But that's Awolo Christopher from Shobule sharing that one. We also have some messages here. Good morning, Sandra. Do you know my mother was taken last month to General Hospital in Ikeja from 6 a.m. to 4 p.m. before we could see the doctor. He later gave us paper to run a test. Could you imagine we're giving January 1st week for that test?
For the test. So that's the situation. So all these things are okay.
That's vex,
because I frequent some of these hospitals, I know what I'm saying.
So what happens to that patient between now and that 1st of January? And that's just test. That's not even anything to reduce the person's pain or whatnot. That's just to do a test. After the test, they still need to go back and see the doctor.
So the thing is not aggravated by the time the test
is done. Alright, we also have here, good morning, Sandra and Fuad. They are all playing scripts, I told you before. They are unfolding their plans to make sure nobody who are this day. David from Idiaraba, who are this day? I think there is supposed to be a follow-up to that day. Good morning, Sandra and Fuad. I greet you guys generously. Our health sector is in a coma. State of emergency is needed in the health sector. It's not everything our doctors will do. We have referral. Let's look at preventing measures where we can take care of ourselves before the sickness comes. Song Attacker from Ikeja. Alright, good morning, Sandra. We told you that the oil that is found in the north will show its true colors. When it says that northerners should not make mistakes like the south, I pity our Presido. Prayer from Ikeja. Alright, thank you very much. Let's take some more calls. Hello, good morning.
Yes, good morning.
Good morning.
Yeah, my name is
Austin Gossens, good morning.
Good morning.
Okay.
About 2 years ago, precisely, about I think 2 years and 3 days now, I lost my brother, and that was because we went to live, and we were told that there was no bed, that everywhere is free, that we have to stay outside, and then the cost was so high because we were told that even if we get a bed, per day is 12,500 naira per day. That's going to be different from the consultancy fee, different from the test, and different from the medications and all that. So we were referred to one place at FF Days. I don't know if you know that place. So the doctors there were not sincere because we were just told that look, this has come beyond what we think, that we can just take it back home and just take care of him. Now imagine the kind of thing to do. Whenever I remember my brother, I just look at the state condition of the hospital, you have the labels and everything. It's so dilapidated. How can the hospital tell someone that you don't have a bed? In a country where we have mineral resources, we have everything to feed ourselves, to take care of ourselves. It should be a law. Let there be a law that if you're a governor, if you're a deputy governor, if you're a president, vice, senator, you cannot travel out of this country for any medical treatment. And now, I can assure you that if such a law is passed, the health sector in this country will be put in place. On this issue, in just seconds, they know what they are doing. I watched an interview this morning on NCA Network, and these people are just blaming themselves. They know what they are doing. They are using Nigeria as a business. Nigeria is not like a business center for these people. Good morning.
Thank you very much. I appreciate that's another look at everything that we're discussing this morning. But then 09136000410. Let's hear your thoughts as regards the conversation for today. Hello, good morning.
I just want to tell you about News Bower. We coming from Ikeja. Ambassador Muswash here, US. The asking after him here. If you want to get a course radio now, course radio like 2.3, course 91 here, and maybe to get through here is difficult for him. He's okay.
No, thank you.
Thank you, Obi. I appreciate that. Hello, good morning.
Good morning.
Yes.
Yeah. My name is Chifu.
Okay.
Madam Sandra.
Where are you calling from, sir?
It's our cricket.
Okay.
Let us always tell our face truth.
Okay.
You cannot put down on governor or make law on governor or president, vice president, and all these things that you address. If you want to do that law, you do the interesting way that all Nigerians, nobody will go abroad for treatment because they are Nigerians too. It's not because they become our leader. Then they ban them if they are going there before, and now ban them again. Is that the issue? Is that the issue? That they do not have anything in the hospital or no, it's not. You cannot make that such law. That is the truth.
Okay.
So let us always believe in what we are saying, please.
Okay. Alright.
I think Chief needs to understand that we are looking at, when you have a critical situation like this, everything continues to run in your head. What can we do to make this people pay attention to the health sector? And that's why we are seeing public officials who are supposed to serve the people, earn from the people, live by the means of the people. That's why we are saying.
Hello, good morning.
Hey, good morning, Sandra.
Good morning.
Yeah, my name is Abeke Adi. I'm calling from Abeke.
Good morning, Abeke. Please go ahead.
Okay, I would like to share my experience at the public hospital. About 8 years ago, I was pregnant for my first child. So I was using a private hospital and a public hospital. So along the line, I was booked by a consultant for induction on Sunday. So over the night, around 3 a.m., I discovered that my baby was not moving. So we quickly rushed to the general hospital, instead of general hospital to be precise, around that 5 a.m. When we got there, we went to the emergency. You know, they conducted, they tested me, they did like the movement of the baby. And the doctor said, we are going to do an emergency CS. We can't use it because we can't get the rhythm of the baby. They now kept me in a room. I have been at the hospital since 5:30 a.m. They didn't operate until past 4 in the evening. Do you know that I was saved by grace? Who knows what would have happened to my baby? And at the end of the day, I had infection after the surgery. You know, these people are killing us. I am telling you, first experience, second experience. So before that, I had to use private hospital. And the doctors are telling to all the doctors, they are the ones in the private hospital. But the kind of service they will render to you in the private hospital is different from the public. They have this unchallenged attitude. Not just it, it's just bad.
Thank you very much. Appreciate first time caller actually. I appreciate you calling in. She had to call in and share an experience. A lot of people would have one thing or the other to say as regards this unfortunate reality that we are facing as a people. I mean, this is even Lagos where there's almost
a lot have been done. Like I said, Lagos seems to have been able to stand out when it comes to maternal health care, but again,
there's still a whole lot of other things that, in the health sector. There's a lot that we have heard coming from Lassos. There's a whole lot of stories that we heard from Lassos, from youth, and all of these places. General hospital in Bagada, where there's very good spacious land. One would think that there's a
crowd too.
You get there, you get there as early as 6:30. They don't attend to you till about 4:30 p.m. Oh my goodness. That is not to say, although they have the emergency, if you bring
the emergency is also filled up.
Even when you get to the emergency, you are delayed at the entrance because there's no space to attend to you. Because imagine the emergency room is filled up. There's no space. There's no bed. I've seen situations like that. It's a very, very serious and dire situation that the government should pay attention to. We have medical centers that there's no water. The health managers, the facility managers, the cleaners are the ones that go to fetch water for whatever it is that they want to do.
The only reason why it's called the hospital center is because they wrote outside. When you go there, it's just a normal building. Nothing is happening. Nothing practically.
Even some chemists is better.
I'm telling you.
Very unfortunate. And that's another thing that we need to look into, because now people can't afford to go to those places, so they go to the chemist, and a lot of all these chemists are not trained, are not professionals. Okay, so that's why you have the wrong diagnosis, the wrong medication and whatnot. So I think at this point we should agree with the experts who are saying there should be some sort of state of emergency declared on the health sector. I mean, when you have statements from the labor minister, the labor and employment minister saying that, let them go, we have enough. That's very unfair for people who depend heavily on these people. Let's wrap things up with a few messages. Good morning, Sandra and Fuad. Compliments of the season. Thank you. I just want to ask, if monopoly can be a solution to our economic woes, the petroleum minister who is in addressing this lingering fuel scarcity shows that the sitting government has failed Nigerians in all ramifications. Liberalized the fuel importation or fix the moribund refineries. Uzoma from Isashi here in Lagos. And Sandra and Fuad, will you be at the airport when the politicians are traveling?
No, you're saying, just thinking aloud here.
Baba Femu from Ikeja is asking that how will you know when they are going? Right. Well, finally, hi Mainland FM. A state of emergency in the medical sector is as last as 20 years ago, because all the nurses and doctors have all jackpot. The level of arrogance and inhuman behavior by the remaining nurses in the hospital is alarming. I can't blame them because the workload and inability to remunerate and grant incentives to these people are also the reason. The fuel scarcity issue might last through the Christmas period and the New Year, but oil discovery in the North I pray will not cause problems there, as we can see the signs. Sean from Festac, we're all hopeful also. Thank you very much to everyone who joined in the conversation this morning. We look forward to having you again tomorrow, same time. However, the beat continues. By 9:45, we move on to Global View, where we talk about international stories. Stay with us. It is Mainland 98.3 FM, and we are the sound of Lagos.